So let's see.
Good morning, good afternoon, good evening, and good night, friends and colleagues from across the world. What a distinct honor to have Dr. Vicky Yamamoto with us today, a leading cancer researcher. Thank you for joining us for today's podium, Dr. Yamamoto.
Oh, thank you very much for having me. I'm very pleased and honored to be here.
Thank you, and we're very excited to discuss with you some of the findings that you have had in your research. Before I go on to go over your bio, some housekeeping stuff for our dear colleagues from across the world that may want to join us for the upcoming 2023 World Gala. As you know, we have opened up registrations as of the 8th. And here is where we are gathering up all of our colleagues from the class of 2020, 21, 22, and 23 from 6 continents to join us and maximizing collaboration between doctors at this monumental event. You can register at Congress AIO and also join us if you're not a top 100 doctor. And one of the main reasons we're conducting also this discussion today is that we want to collaborate more with the medical and the research community as doctors, as everything is sort of related, especially with the brain, which relates to everything in the body. So with that said, I'd like to introduce Dr. Vicky to the audience. She's a cancer scientist at Keck School of Medicine of USC in the Department of Otolaryngology, head and neck surgery, with more than 10 years of research experience, ranging from developmental neurobiology and stem cell to molecular targeted therapy. Prior to joining the department at Keck School of Medicine, Dr. Yamamoto worked at Mount St. Mary's College, the Scripps Research Institute, the Maxine Dunetz Neurosurgical Institute at Cedars-Sinai. Wonderful. And California Institute of Technology. She has significant teaching experience and mentored numerous students. I have personally followed her work for years. And she has been a recipient of countless awards, including the Young Investigator Award from SPMT, a predoctoral fellowship, a CRM predoctoral fellowship from California Institute of Regenerative Medicine, as well as numerous other awards. It would take me most of the session to read them off, but she graduated magna cum laude from Mount St. Mary's College with a bachelor's in biological sciences and a bachelor's in chemistry. She received a PhD in biochemistry and molecular biology from the Keck School of Medicine of USC. Wow, what an amazing career you have had, and currently also the sitting president of the Society of Brain Mapping and Therapeutics. What is your secret, doctor? What's your motivation?
Oh, yeah, I'm always have been interested in, of course, biology and medicine. What motivated me initially is that, really, brain research is actually my first love in research. Actually, working at the neurosurgery department at Cedars-Sinai Medical Center was my first, professional research experience. And the brain is such a very important, organ from the entire, vital organs. That's my personal, opinion about the brain, and really important to keep our brain healthy. And if disease arise, it's really important for us to develop a better way to treat the brain. So that's my whole motivation.
It's amazing what you do. At every conference I see you, I am very interested in your next project and get a briefing.
Thank you.
Very, very. So you did some work on cellular development and growth and differentiation in the central nervous system. Specifically, your work with WNT signaling has opened many doors for other clinicians. Is that correct?
Yes. So that's my PhD dissertation topic. So basically, I was actually studying about this newly discovered protein found in developing brain of mouse, and then basically this is actually the same protein that also exists in humans as well. So my role in that project was to try to find out what exactly that protein and how this protein is playing, role in a neuronal development. In particular, we are interested in trying to find out the role of this protein in neuronal stem cell proliferation as well as neuronal differentiation. So that was my whole project, and which was
Wow.
actually published. Yes.
Yes, I saw your work on regenerative dentistry as well. It's so important that all of these different sub-medical specialties collaborate with each other to understand the latest research and knowledge. For example, in our profession, I perform a lot of surgeries, so I encounter sinus problems, I encounter nerve issues, I encounter all those things. I see oral cancer from time to time, which we discover. And it would be good to know what the latest options or right protocols are to proceed with them than simply just referring it to a specialist who doesn't also know what the latest things are. So it's very important that we collaborate with one another. So in terms of teeth, oral cancer is very, very important to us because if we discover, for example, squamous cell carcinoma, we have a very limited 5-year lifespan left on the scenario, and it would be good to recognize it early and intervene. So your presentation is going to discuss a little bit of those things as well, I understand, right?
Yes, exactly. Yes.
Fantastic. I saw you just met the President of the United States. How did that go? Was that exciting?
Oh, yeah. That's good. Yeah, that happened about a month ago. So, we actually met with the president. We were very honored to meet him in person. This is the first time I actually meet with any president of the United States.
That's lovely.
We briefly, yes, exactly, and then we briefly discussed about how important for us to develop a better way to treat brain diseases. That's also including, of course, brain tumor as well, which I know that our president is really interested. Especially, he has established this cancer moonshot. So we know that he is really interested in cancer research. So we are very, very honored to be able to speak with him.
That's lovely. It's amazing what you guys have done at SBMT, and I've seen you guys at G20 events, holding N20 events, and you guys are really impacting the world, which is very admirable. Thank you for your contribution to the world of science and medicine, and hopefully with this podium today, our colleagues will have information about SBMT. I highly encourage dentists to become members. When I went to your event last year, I saw doctors from every aspect of medicine and healthcare. I don't think there was one missed, from pharmacists, there were dentists, there were doctors, there were researchers, sports medicine, neuroscientists, vascular surgeons, down the list it goes. So I highly recommend your organization and the amazing job you have done. And I'm very much looking forward to your presentation. So I'm going to quiet down a little bit. And with that said, you have the floor, Doctor. I'll be in the background.
Thank you very much. Thank you very much for a kind invitation and all the great introduction. So let me share the screen. Okay, so let me stop. Okay, hold on just a minute. Seems like this is not. So let me share the screen.
There you go.
Okay, great. Okay, great. Excellent. So thank you very much for having me again. My name is Vicky Yamamoto. I'm currently working as a cancer scientist at the USC, North Comprehensive Cancer Center, Keck School of Medicine at the USC. So my topic is about head and neck cancer. So this is just to show that I have no financial conflict of interest for this presentation. So actually, I'm coming from a USC, so this is the campus. I'd like to show it to you. If you have a chance to visit the campus here at the Los Angeles, please let me know. I'll be happy to give you a tour. So for the outline for this talk, I'll be briefly talk about cancer in general. and its limitation, issues, and unmet needs in the cancer treatment. And then I'll be focusing more on head and neck cancer, which is my specialty in research. And I'll be also talking about what are the recent advancement in cancer research, as well as some of those breakthrough treatment in head and neck cancer. And also I'll be talking briefly about the importance of multidisciplinary and global collaboration to fight cancer. And lastly, we will just try to discuss what can we do to detect head and neck cancer early. Okay, so cancer is a worldwide problem, as you can see from this piece of figures. So WHO estimate that we by this is actually the data a little bit older, but by 2018 we had about close to 10 million cancer-related deaths. And so as you can see from the graph, they expect that by 2025 we'll have about close to 20 millions of cancer cases worldwide, and we will expect to see about 11.4 million cancer deaths by the year 2025. So when it comes to progress in cancer treatment, have we see any big improvement? So if you take a look at this figures in the left side, unfortunately the answer is not quite something that we want to see. So as you can see from compared to 1950s, which is on the green bar, and then 2004, which is on the red bar. So it indicated that if you take a look at the heart diseases, cerebrovascular disease, and pneumonia, you can all see that the deaths per 100,000 people are actually decreased significantly. But if you take a look at the death rate for cancer, between 1950s to 2004, we don't see a huge improvement, unfortunately. And on the right corner, I actually put the more latest death rate for cancer. Again, it's actually close to about 185 deaths per 100,000 people in the population, unfortunately. So after, of course, we spend so much funding and time to do research and fighting cancer, and after millions of publications per year, so far we are able to extend about only a few weeks of life in most solid cancer. So which is unfortunate. But one good advancement in the past 10 years is that probably some of you may probably have heard about immunotherapy, like for instance nivolumab or Tivo, the Keytruda, and probably you might probably heard about this checkpoint inhibitor medication. So hopefully in the next 10 years or so, we will see a little bit of improvement in a death rate. But so far, we are just really far from a really ideal situation. So, and of course, some type of a cancer, for instance, breast cancer, prostate cancer, and leukemia, you will see 5-year big improvement in 5-year survival, as you can see from this graph. So, which is a great news. However, in many solid tumor, unfortunately, 5-year survival is really, really poor. And especially if you take a look at the right corners, and as you can see, lung cancer and liver cancer is a pretty popular cancer in the United States. And you can see that 5-year survival is about less than or around 10%. Now, of course, pancreas cancer is one of the worst type of cancer, where survival is very low. And if you take a look at actually head and neck cancer, you will see it's around like a 70%, and then you would think that, oh, this is not terribly bad, but then this has a little bit of a caveat, as I will explain to you a little bit later, because this is a combination of the HPV positive and HPV negative cancer. And usually HPV positive cancer has a better prognosis, which is about 70 to 80% of as a 5-year cancer survival rate. But then if you take a look at more traditional HPV negative cancer, actually 5-year survival will still remain about 3 to 40%. So this is why 5-year survival here in the United States for head and neck cancer is better, because it's a mixture of HPV positive and negative. But the reality is the smoking induced head and neck cancer, still 5-year survival is pretty low. So what are the factors that make cancer treatment so difficult? Mainly because of the treatment resistance. So we have so many different kinds of chemotherapies available right now. And of course, we have surgery and as well as radiation therapies. But then only about 30% of patients usually responds to many of those treatments. That's including chemotherapy. And especially this is true for solid tumors. And also in many cases, we experience a recurrence, meaning that the cancer sometimes comes back after the treatment. Typically that happens about half a year, 1 year later after treatment, which is really has a poor prognosis. And the metastasis is also, which we consider that as a major cause of mortality. This is a phenomenon that the cancer started to spread to the other parts of the body. And this is especially true for head and neck cancer. Most often cancers are diagnosed too late. And in many type of cancer, if you get diagnosed in early stage, like stage 1 and stage 2, most cancers are pretty curable. But then when it comes to head and neck cancer, most of those diagnoses are made in stage 3 to stage 4. That's when we're having trouble how to treat those kind of cancer. And then, of course, some cancer type we know that surgically it's very difficult to remove. So this also causes cancer treatment failure. And cancer care costs are very, very expensive, and then continue to increase, especially in the next 10 to 20 years. So here the statistics shows that by 2020 in the United States, the cancer costs exceeded actually a little bit over $200 billion annually. And then this cost will expect to actually increase more in the next 10 years. And then, of course, financial burden with cancer care by site, as you can see, cancer, again, depending on the site, the cost can be different. Especially when you take a look at this data, you can tell that brain tumor and leukemia treatment are one of the most costly in cancer by sites. And on the contrary, if you take a look at the oral cavity or head and neck cancer in general, this is not as expensive as a brain tumor or leukemia treatment, but still compared with the average overall site, oral cavity or head and neck cancer treatment is more like a moderately expensive cancer to treat. So head and neck cancer. So basically, head and neck cancer is any cancer that actually arises inside the oral cavity, or neck area. That's including the tongue, salivary glands, inside of anywhere in the oral cavity, as well as the pharynx. That's including nasopharynx, oropharynx, and hypopharynx, and also the vocal cord, the larynx area as well. And also, nasopharyngeal carcinoma is also considered as a head and neck cancer, but in the United States, nasopharyngeal cancer is relatively rare. Most cancer in the United States, head and neck cancer in the United States, usually refer to something happening in the throat and the tongue region. And a symptom you can see from the right side of the panel. Most people started to realize that they may have a head and neck cancer because of persistent sore throat, as well as some lumps and bumps or mass without any pain. So this is actually about the HPV negative head and neck cancer. But so this HPV negative cancer actually is caused by mainly caused by smoking, and and as well as also heavy consumption of alcohol. But mainly is caused by smoking, which is actually caused all the accumulated DNA or genetic mutation happen over time. So this is a part of the reason why it's so difficult to treat, because smoking cause all these stepwise DNA mutation. So at the time of cancer diagnosis, the patient usually have so many different type of DNA mutations. So that's one of the reasons why it's very difficult to actually treat this type of cancer. So as I mentioned earlier, people realized that for back in probably about 1980s or 90s, you will start to see some decreasing trend in the case of cancer or head and neck cancer. That's because compared to our older generation, younger generation already are educated and know that smoking is really bad for your health. So the number of smoking population is getting lower and lower each time. So we have seen some lowering in the number of head and neck cancer. But then back in 1980s or 90s, then you will start to see more and more head and neck cancer, and especially for those who are younger and non-smokers are getting head and neck cancer. And then we thought that, why this is happening? And then it turns out that HPV infection can also cause head and neck cancer. And as you can see from the United States, that usually right now is happening in basically in the United States as well as European countries mainly. But you have seen such trend also in other parts of the world as well, including in Asian countries as well right now, unfortunately. So as you can see from this graph, so since back in 1980s or so, if you take a look at the yellow line, which is overall oropharynx cancer, which is actually happening in the throat region. So the number of cases are slightly increasing trend, fortunately, since 1980s. And if you take a look at HPV negative oropharynx cancer, you will see that it's being actually decreased significantly. But then when it comes to HPV positive oropharynx cancer, you will see a huge increase. So data also shows that here in the United States, back in 2010, in fact, the HPV-related oropharyngeal cancer number, case number actually surpassed HPV-related cervical cancer in 2010 as the leading anatomical site for HPV-related cancer right now. And if you take a look at the oral throat cancer or oropharyngeal cancer cases in the United States, about 70 to 80% are considered to be HPV positive. So now HPV have so many different type of subtypes. So we now know about at least 19 different HPV types are known to cause cancer. But then vast majority of HPV positive cancer is caused by HPV type 16 and 18. So we think that the HPV positive head and neck cancer is just epidemiologically and clinically very different cancer compared to HPV negative cancer or traditional head and neck cancer, which is caused by smoking. So if you, this is actually the data of those incident age, as well as the socioeconomic status, risk factors, and location tumor. So you can see that HPV positive and negative cancers are very distinct. And also, when it comes to also a little bit of genetic, mutation or pathway, they're pretty similar. So you will see some abnormality in the TP on P53 pathway as well as RB pathway. But then, when it comes to survival, you can see huge difference. So if you take a look at the HPV positive head and neck cancer, 5-year survival again is about 70 to 80%. But then smoking causing traditional HPV negative head and neck cancer, 5-year survival is usually less than 40% now. So we think that those two HPV positive or HPV negative cancers are very biologically, clinically, epidemiologically, they are all distinct cancer, although they are receiving a very same treatment. So again, this is the data to show how HPV positive and HPV negative cancer are very different when it comes to survival time. This is actually, again, 5-year survival for HPV positive cancers are much better when compared to HPV negative cancer. So, but nevertheless, head and neck cancer is a relatively common cancer worldwide. So globally, head and neck cancer is the 7th most common cancer, and with the annual incidence of over 740,000 new cases, of which about we estimated to have 360,000 deaths reported worldwide. Here in the United States, we know that over about 65,000 new head and neck cancer cases are reported, and approximately 15,000 deaths are reported every year. So meaning that basically one patient dies every 35 minutes. So how to reduce the risk of getting head and neck cancer? So easiest solution, or it's probably maybe hardest, but the easiest to prevent will be to try not to smoke. So that's actually the key to prevent the HPV negative head and neck cancer. And also heavy drinking is also can also cause a head and neck cancer as well. So try not to consume alcohol more than 10 drinks per week. And especially this is true for Southeast Asian countries, but chewing those betel nuts and chewing tobacco is pretty common. So try not to actually chew those, chewing tobacco or betel nuts. That's actually the key to prevent the HPV negative head and neck cancer. So for HPV positive head and neck cancer, we now have a very effective HPV vaccine. Before it was only Gardasil 3 or Gardasil 4, or there were only 3 or 4 different types of HPV subtypes are prevented. But then now we have what we call Gardasil 9, which can actually prevent HPV. 9 different types of the HPV subtypes can be prevented by this HPV vaccination. And FDA also approved or increased the age of administering this HPV vaccine by up to 45 years old back in 2018. And this HPV vaccine is highly recommended for both men and women as well. As you can see that, before traditionally HPV vaccine was mainly for women because of cervical cancer, but then now people find out that HPV can cause head and neck cancer, especially in the head and neck cancer, especially for men. So we now recommend both girls and boys to receive HPV vaccine if possible. And also visit dentist regularly is very important as well. And then for those who are visiting dentist regularly, make sure to ask the dentist to carefully check for any lumps and bumps or red or white patches in the mouth, because those can actually later, over time, can actually develop into cancer as well. So just make sure to ask the dentist to check the inside of oral cavity carefully, not only the teeth, but inside of mouth as well. So current problem. So even now at this point for cancer treatment, one of the most effective chemotherapy is actually platinum-based chemotherapy. But then the problem with this actually chemotherapy is that they indiscriminately attack rapidly dividing cells. That's including cancer, but also including normal cells as well. So that is actually the basically the serious problem with the current treatment, because it can cause serious side effects. And also, again, at this point, metastasis is probably the main cause of mortality in cancer. But then at this point, so far, we do not have a very good effective drugs to prevent metastasis. And that's partially because we still do not know exact mechanisms of metastasis yet. So that is actually a big problem. So in order to improve the outcome of a cancer treatment, it's very important that to find a solution to try to prevent metastasis and to develop a better targeted therapy. So we have a lot of information now, luckily, about the hallmarks of the cancer. That's actually the very targetable pathways or signaling system and protein. So it's really important that we actually find out what will be the exact mechanism, molecular mechanism of what is happening inside the cancer, so that we can identify the targetable pathways or protein, so that we can increase that more specificity to target only the cancer, but not the normal cells. So for us, for particularly in my research field, we are interested in attacking cancer stem cell. So, of course, most of us heard about the stem cell. Stem cell is actually the type of a cell exists in small niche where, if necessary, then the stem cell will start to divide and then differentiate into specialized cells or tissues, which is very important for normal, organs and normal tissues. But then we now find out that even cancer also has a stem cell-like or stem cell inside of cancer. So we believe that many of those tumor initiation or tumor recurrence to metastasis or chemotherapy or radiation therapy resistant may caused by this small population of the cancer stem cell. So my research was mainly focused on try to improve radiation or chemotherapy sensitivity by trying to eliminate or eradicate cancer stem cell as much as possible. So one of which the project I involved was to try to screen some of those novel as well as already FDA approved drugs with our collaborators, and then try to find out any of those drugs or small molecule inhibitors can actually reduce the amount of stem cell inside of cancer. So we identified a couple of promising drugs already. For the detail, I cannot disclose because we have not published this data yet, but then we already identified a couple of promising drugs that can be used to eliminate stem cell population. So one of the, let's see, yes, this graph or figures that are shown in left lower corner, this is actually the cancer stem cell. We normally grow cancer stem cell as a kind of 3D sphere, which is enriched with the stem cell population. So if you take a look at the control, they're nice form, nice sphere form. But then if you add actually this small molecule inhibitor, even at the nanomolar scale, you can see that the spheres, the size of the spheres and number of spheres dramatically decrease. And you can also check the stemness marker, CD44 and OCT4 are also markedly decreased. So this is a very promising small molecule inhibitor. And when we finish investigating this drug in an in vitro model, we normally actually go into the small animal experiment to try to just validate whether this drug will actually work or not. So this is actually the piece of data showing that in an animal model or mouse model, when we implanted or transplanted this head and neck cancer in a mouse, and then we irradiated with or without this drug. So you can really tell that using this actually drug, we just name as a drug X right now because this is actually before the publication. You can tell that by combining this drug, which would supposedly eliminate cancer stem cell, and combined with the radiation therapy, you can see that the tumor size dramatically becomes smaller compared to radiation alone or this drug alone, or compared to the control, of course. And the possible solution too, again, like I mentioned before, that metastasis is actually the number one killer of cancer normally. So if there is any way to prevent metastasis or not, so many scientists, including myself, are actually trying to work and see if we can actually stop the metastasis by using some kind of medication or not. So this is actually the molecule that we are studying, which is called alpha-catuline. This is actually a very important protein that control the neural tube closure in the brain. But then it turns out that this same protein, which is important for mouse brain development, are actually expressed in many different types of cancer, that's including head cancer. So we find out that this protein called alpha-catuline also expressed highly at the invasion front of those migrating head and neck cancer. So if you see, take a look at compared to the normal mucosa, and then if you take a look at the grade 3 head and neck cancer, you can see that as the tumor started to invade normal tissue, then you will see that alpha-catuline is highly expressed in this invasion front. So we think that it is a very important molecule when it comes to the cancer, which started to migrate or try to metastasize. And then we also actually already prove that this alpha-catuline is very important for head and neck squamous cell carcinomas metastasis in mouse model as well. So another promising treatment that you may probably will start to hear more and more, maybe in a near future, is called BNCT, or boron neutron capture therapy. So this is a new type. Well, this is actually, it's not really that new, which is actually was developed in back in, I think, 1960s or so in the United States. But unfortunately, at the time, I think in the United States, the clinical trial did not go well, and that treatment is actually kind of abandoned. But then now this, what we call BNCT therapy, is actually started to actually use in some other country, especially in Japan and in Finland. They already started this therapy for head and neck cancer. So basically, this is again, it's a very selective radiation treatment. So what happened is that in this treatment, we introduce this very stable boron isotope called 10 boron. This boron basically will be accumulated only inside of a tumor. And then after this, then we irradiate those cancer with this low energy neutrons. So basically what happens is that those irradiation cause those boron to actually breaks down and generate a radiation within the cancer, but then it will not damage the surrounding normal tissue. So we think that this is a really, it's a game-changing, radiation technology where we just only target the tumor, but not the surrounding normal cells. So this will be very helpful, especially for the cancer, like a head and neck cancer, and also perhaps a brain tumor as well, because this is a very specifically target only the cancer part, but not the normal tissue. So this hopefully will improve the survival and will result in less less damage in the surrounding tissue. And in fact, that we actually I'm actually right now currently working in collaboration with the Loma Linda University and other university to see if we can actually utilize this to test whether this can be used to attack or kill only the cancer stem cell, firstly in vitro and in vivo as well. And this is actually enable us, or actually the new actually technology called accelerated based neutron source is that actually the driving force for us to actually utilize this VNCT treatment, because before we need this nuclear reactor, which is very expensive and occupy a huge space. And it actually is very dangerous to have a nuclear reactor surrounding a hospital. But then now we have a very small, almost like a portable, accelerator-based neutron source. So this actually enables us to build this VNCT center even in the hospital setting. So now I'd like to move on to Society for Brain Mapping and Therapeutics, which I'm actually involved right now, and I'm serving, I say, one of a founding member of for SPMT, and I'm actually currently serving also as an executive director for this medical organization. So basically, for our SPMT mission is to try to improve the diagnosis, treatment, and rehabilitation of patients afflicted with neurological disorders, any type of neurological disorders. That's including also mental health issues as well. So, so we really value collaborative effort by different disciplines. That's including not only clinicians, but then also scientists and engineers and policymakers, and as well as other funding agencies as well. So this is our approach in trying to come up with a better actually prevention and treatment for neurological disorders, which we are also involved for the past 20 years or so. So as a result of this collaboration, we were able to actually generate a lot of publications on the topic. And we also came up with many different innovative way to treat brain tumors as well as other type of neurological disorders, that's including Alzheimer's diseases. And then we really believe that the collaboration and partnership is the key to advance the science and medicine. So in fact, that initially we started only within the United States. For the past 7 years or so, we actually started to partner with the international collaborators, and then so we actually established N20 or Neuroscience 20, which actually we have this summit whenever they have actually G20 event or G20 summit. So this year we are expected to have a Neuro 20 summit in Indonesia in November 2022. So if you're interested, please let us know. We love to actually have participants. So in the last, this is actually going to be my last slide. So how can we actually diagnose head and neck cancer early? So head and neck cancer, as I mentioned earlier, 5-year survival is not that great. That's because most of us actually get diagnosed at the stage 3 or stage 4, which is very difficult to actually treat at the time. But then if the head and neck cancer is discovered in, let's say, stage 1, for instance, then it's pretty highly curable. As you can see, that 5-year survival of stage 1 head and neck cancer is usually over 90%. So, so is there any better way to diagnose head and neck cancer early? So I know that my collaborators, especially in Australia, for instance, they have been working on some sort of like a good promising biomarkers that can be found in the blood or saliva. But then they are still in clinical trials, so it may probably take another perhaps 5-10 years or so to bring this technology or technique to actual clinical setting. It's a little bit a long way to go, but now, I just would like to bring attention that nowadays, maybe in a near future, we might be able to find a head and neck cancer by routine blood test or maybe check with the saliva. And also, especially if this is important for our audience here, they may have a very good important role for dentists. So as a dentist, if possible, I would like all these dentists to actually examine any abnormal lumps or any abnormalities found inside of an oral cavity. And especially, I really recommend all these dentists to check for white patches or red patches, what we call leukoplakia and erythroplakia. Because if you see all these white patches, for instance, this is mostly it's not really a serious problem. It's benign, but then the risk of developing cancer in the next 10 years or so of having leukoplakia is about 3 to 17%. And if you see even red patches or erythroplakia, for instance, the risk of developing cancer is even higher. It's about 20 to 50% over the next 10 years or so. So it's really important that those dentists to be able to detect those some lumps or abnormality or red or white patches during routine checkup. So this is actually the some of those examples. I'm pretty sure that the dentists are all probably familiar with what to look for. So these are something that I actually personally would like to promote, to take a look at those abnormalities more closely to detect the cancer. Okay, so this is about this. So thank you very much for listening, and hopefully my talk really raise our awareness about those head and neck cancer, and hopefully we all engage in clinically or research that try to come up with a better way to diagnose early and a better way to treat this cancer to improve the overall survival of those patients. So thank you.
Thank you so much, Dr. Vicky. What an amazing, presentation. A couple of questions for you.
Oh, okay, yes.
So a dentist is looking in the mouth during a routine exam, and we see a white leukoplakia type scenario on the tongue or on the cheeks. What is the first step? Brush biopsy or refer to what would you recommend the first step should be?
Okay, so first thing is just to bring awareness to the patient. So for instance, probably it's depending on, of course, for instance, the leukoplakia, maybe the size or also, appearance will be different, different type of leukoplakia. But then I think it's really important that to tell the patients that you have this type of abnormality and what will be the risk in the future, because those are not cancer yet, of course, and not every those white or red patches will develop into cancer in the future, as you can see. So what important thing for the dentist to tell the patient that you have this abnormality present in the mouth, and if you are worried, then just try to check up with the ENT or head and otolaryngologist or head and neck cancer specialist to check, just to make sure, because what they do here at head and neck specialist is that they will take a little bit of biopsy, and they will also check to see if the patches are really serious enough to try to remove on that. So they can actually decide whether this is something that just monitor or just have a biopsy or not. So it's very important to just to check. And if you monitor, and then some of them may probably start to disappear in a few years or a few months. So depending on the type, so that's why I think it's really important for dentists to detect such abnormality and tell the patient to just try to make sure you check and monitor to make sure that it will not progress the cancer, or even if it progresses the cancer, we will detect at stage 1, early stage, so that it can be treatable.
Excellent. And upcoming in the N20 that you're going to be holding in November, what can the audience expect? What is the topic? What are you guys trying to achieve there?
Okay, so the topic can be it will cover everything, all the neurological disorders. That's including also mental disorders, and of course as well as cancer, of course, and the cancers and Alzheimer's disease and everything will be covered. So our role is to try to come up with a better, because this is more like a for policy, making. So basically, we just try to come up with some sort of a possible solution, and to increase that also awareness, as well as to change the policy, so that all this effective treatment will be available for those patients who are suffering from neurological disorders.
Excellent. Wonderful. I hope a lot of our colleagues will join you at your upcoming event in November, and also at your gala that's coming up. On a second note here, your gala is your
Yes.
20th anniversary, correct? In February
Yes,
in LA?
exactly. Yes, yes. So basically, so our gala, Spin Peace or Brain Mapping Foundation Gala, will be happening in February 17, 2023, in Los Angeles, downtown LA. So so this event is basically is a fundraising event, as well as to try to highlight and award all these scientists and clinicians and policymakers who actually contributed a lot in when it comes to make awareness about neurological disorders, as well as to somebody who contributed a lot in the treatment of neurological disorders. So this is a red carpet, event, and also this is like almost like a Oscar award for neuroscience. So as you know, Dr. Shah probably attended last year. Of course, thank you very much for attending, and you probably have seen how we actually hold this event, and it's a really fun, event. So I really hope that our audience can actually participate if you are available and if you are nearby Los Angeles.
Yes, I really, really enjoyed the event. And it was quite amazing, actually. And I also encourage our colleagues to attend. Where would they get registered at? SBMT, is it .org? What is the
Yes, you
website?
can go to www.worldbrainmapping.org, and then just click on the gala, annual gala, and then you will see all these events information, as well as the registration information as well.
Worldbrainmapping.org, friends. Well, thank you so much for your time on a Sunday. We really appreciated you, and that you brought all this information to us. And hopefully we can increase our collaboration in these events, and then many to come. And again, thank you, and have a great Sunday, Doctor. We look forward to having you back on sometimes.
Thank you very much. Yeah, I'm very happy to be here, and we appreciate your invitation. Thank you. Bye.
Thank you. Have a great one. Take care.
Thank you.